What if you could fall asleep and get more restful and restorative sleep naturally? A lot of us have trouble falling asleep at night. If we're lucky enough to fall asleep, we wake up in the middle of the night and can't even go back to sleep. The next day we're tired, it's harder to get out of bed, we're late, and then we're sleep deprived and we can't even think straight all day. Hey, welcome to the channel. If you're new here, I'm Zane, and here we discuss easy ways to live healthier. I may be a doctor, but I'm probably not your doctor, so be sure to discuss your individual situation with your own healthcare provider. Today we're talking about sleeping better naturally or without medicines or sleeping aids. Keep watching if you need help falling asleep now, but stay till the end for tips on how to sleep better every night. All the sections are timestamped below for your convenience. So, what to do if you can't fall asleep right now? Most of us, when we can't sleep, just continue to lay in bed frustrated, waiting, acting like falling asleep will just happen any moment now, like hitting the slots at MGM. Well, it's been 6 hours and I'm broke. Try a relaxation technique, such as the pilot sleep technique. The story is that it's meant to help pilots fall asleep anywhere, even when seated. I tried it and you know what? It actually worked. So you basically relax your whole body, starting with your face, down to your feet, and clear your mind. Stay tuned for step-by-step instructions. Still can't sleep? Get out of bed and do something relaxing, not involving screens. Read some fiction on a Kindle or a physical book. Stretch or do some yoga. Drink something warm and caffeine-free and alcohol-free like a glass of milk. It might feel weird being out of bed in the middle of the night, knowing that you need to go back to sleep, but if you're laying in bed not sleepy and unable to sleep, you could associate your bed with the inability to sleep. So consider going back to bed when you're sleepy, then you have a better chance of associating your bed with the idea of sleep. If your thoughts are racing and you're thinking about all the things you have to do tomorrow, write them down. Grab a pen and paper and get it all out of your mind. We'll talk more about this in the section on nighttime routines. Make sure the room is cool. What's the ideal temperature? Well, in general, whatever is comfortable for you, but experts recommend anywhere between 66 and 70 degrees, but adjust your thermostat according to your own comfort. How to sleep better tomorrow night. In the morning. Use light to wake up in the morning. Use a bedside lamp or your favorite voice assistant and smart lights to brighten up your room. Better yet, set the lights to turn on automatically at a certain time or right when you turn your alarm off. Or even better yet, go outside and get some natural sunlight as soon as possible to jumpstart the next phase of your circadian rhythm. Sunlight is over 100 times brighter than indoor light, even in the shade. During the day. If you find yourself tired during the day, limited caffeine and quick naps can help keep you going, but in the afternoon, this could interfere with your ability to sleep. Caffeine is processed differently by everyone, but it can last in your system for hours. Cutting back on the amount of cups that you have in a day and having your last cup no later than somewhere between noon and 3 p.m. might help you fall asleep easier that night. Side note, dark chocolate has a surprising amount of caffeine. Enough to potentially keep you up at night. Even in people who are immune to caffeine later in the day and who are able to sleep even after an evening cafecito, you could still potentially get less restful sleep. Naps can help you recover some energy if they're under a couple of hours and before 2 or 3 p.m. so that they don't interfere with your sleep that night. In fact, power naps around 15 minutes long have been shown to lower your blood pressure, improve learning and memory, and improve your alertness and focus. Side note, prophylactic naps before long stretches of time where you need to be awake, residency, can help with alertness and reaction time in the evening. Try to limit alcohol in the couple of hours leading up to bedtime. Even though alcohol can make you feel like you're sleepier, it's actually more of a light sedation, so your sleep won't be as restful and you won't get the same benefits as a sober night of sleep. If you're prone to staying up all night worrying about things, getting things out of your head and onto a list has been proven to help. Make a to-do list. The longer the list and the more specific the task, the better. Write down what's bothering you, what you're worried about, what you can't stop thinking about, and get it all out of your head and onto paper or a device. Closer to bedtime. Bedtime routines aren't just for your 1-year-old niece. Shout out to my little niece. That's right, a warm bath and some dim lights an hour or two before bed, followed by a relaxing activity can really help you doze off. Start to dim the lights and stimulate your brain's natural release of melatonin the hormone that basically makes you sleepy. The light from screens can interfere with the release of melatonin, so consider switching to a Kindle or a physical book closer to bedtime. A warm shower or bath an hour or two before bed can actually help set your body to the right temperature for sleep. Combine that with a cool room and you could be sleeping muy bien in no time. As your bedtime approaches, do something relaxing like some stretches, some yoga, or some meditation. And when you're in bed, consider grabbing a Kindle or a book at that time too. And when you're ready to doze off, try a relaxation technique like the pilot sleep technique I mentioned in the beginning. Here's what you do. Step 1, take slow, deep breaths, and this is key. Let all the muscles in your face relax, starting from your forehead, to your eyes, to your cheeks, your mouth, your tongue, and your jaw, and let them all go completely limp. And then exhale. Then once your face is relaxed, the rest of your body can follow. Then let your shoulders drop as low as you can let them go. Relax your neck muscles all the way. And then start relaxing your biceps one side at a time, starting with your dominant side. Then your forearms, and then your wrists. Take a slow exhale to let out all the tension. Let your thighs sink into the bed one side at a time and then work your way down to your calves and then your feet, literally telling them to sink into the bed. Then clear your mind by paying attention to your breath. You can also focus on a mantra or think of a relaxing image. Or just say, don't think, don't think, don't think, over and over again for 10 seconds. Going forward, there are some key things you can do on a regular basis to get the restful sleep that you deserve and all the mental and physical benefits that proper sleep has to offer. Exercise, in addition to tons of other health benefits, helps you fall asleep faster, stay asleep longer, and get more restful sleep. Try to keep a regular sleeping schedule even on weekends. Your body doesn't know the difference between weekdays and weekends, so sleeping at the same time and waking up at the same time every day, even on weekends, can help prevent disruption to your sleep cycle. Think about it. How much harder is it to get up on a Monday morning compared to other days? A lot of us are still gonna stay up late on Friday and Saturday night, but I think the key takeaway from this is to try to limit how late you sleep and really try not to sleep in too late, especially on Sunday mornings. When to see a doctor? If you can't sleep and simple techniques don't work, you should probably see a doctor. More reasons to see a doctor include, but are not limited to, waking up in the middle of the night with chest pain, palpitations, coughing, gasping for breath, or trouble breathing. Feeling sleepy during the day, falling asleep during the day, or falling asleep easily like at the wheel or in a waiting room. Feeling paralyzed in the morning. Feeling like you don't need sleep to function. Sleeping too much. Sleepwalking. Restless legs, your legs move, jerk, or feel strange at night, or feeling like you have to shake your legs to feel better. Difficulty laying down flat for any reason. Snoring loudly. Drinking alcohol to fall asleep, or if it's been a year since your last checkup. So to recap, use bright light during the day and avoid too much light at night to help nudge your brain into wakeful and sleep modes. Keep your mind cool with a relaxing routine to wind down. Keep your room cool. Exercise to upgrade your sleep. Keep as close to a routine as you can. Watch the caffeine and the alcohol. Associate your bed with sleep. And if you still can't sleep, see a doctor. Well, there you have it, peeps. Hopefully these tips can help you get a better night's sleep tonight and every night. If you found this information useful, like the video and let us know in the comments if you want to know more, like the specific health benefits of improved sleep. That's it for now. Peace and stay healthy.